The prognosis of patients with relapsed refractory ALL is quite poor. So it doesn't matter if you're an adult patient or a pediatric patient. Once your disease relapses, it has a very bad prognosis. So in this context, the development of CAR T-cell therapy has tried to give an answer to this population, and almost all CAR T-cell therapies are conventional CD19 targeted second generation autologous CAR T-cell therapies across academics and industry institutions have achieved very high response rate, let's say above 70%. So that's really good efficacy. But again, even achieving a CR puts the patient in a very high risk of relapse. So CAR T-cell therapy, high response rate, but again, high relapse rate. So talking about some specific features that allow us to reduce the risk of relapse, we have all preceding therapies or preceding aspects that we can control somehow, and also all other post-treatment parameters that we can also control, like the performance of consolidated therapies. So currently we're running multinational retrospective analyses within the GoCART Coalition, and we have contacted several dozens of centers about the outcomes, real-world outcomes of ALL patients, both pediatrics and adults, about the impact of preceding therapy and consolidation therapy. And so far we have received outcomes of more than 350 patients. We're currently analyzing all the impact of salvage therapy, bridging therapy, so we will be able to analyze which is the impact of which therapies, specific therapies, chemo or targeted therapies like blinatumomab or inotuzumab, to see which is the right sequence of these therapies to allow for the best situation, the best possible situation for CAR T-cell patients to receive CAR T-cell therapy. And also we will analyze the outcomes of consolidations after CAR T-cell therapy to try to identify which patients should be consolidated with, let's say, a stem cell transplant, and which patients should not be. So this will be only answered after we have been able to analyze all these patients. The analysis is just going as we speak, and we might have the outcomes in the next months.